All right, so we are going to be taking maxillary and mandibular impressions today. I do want you to know how the unit is set up. You will learn to fully set up the units in Dental Assisting Techniques 1, but for dental materials, all we will need is a chair cover. I want a tray paper on the table over here, and you can put a tray paper over here on the bracket tray. All right, and that should be it. The other things I want you to know is your spray bottle should be out and ready to go for disinfection at the end. And you do want to get your damp paper towels that we will wrap the impressions in already ready to go. Okay, so now you can see I have my PPE on. I have washed my hands. Your patient should be seated with a bib. We do not want to get anything on their clothes, okay? All right, so first step, one other note is I have already measured out my water with filtered water over at unit 17. So maxillary, we have 3, because we're gonna do 3 scoops on the maxillary, and my patient does not have wisdom teeth, so it's 2 scoops on the mandibular. So the water should be ready to go, and now I will do my powder. We will fluff the powder, so you're just gonna shake it a couple times. And I also wiped everything down. So the bowls have been cavity wiped, the spatula has been cavity wiped, the water containers, everything. Okay, when you clean your unit, make sure you do that. So almost like baking, you're gonna pat it through and you're gonna level it off and you're gonna put in one of the bowls. Again, one bowl will have 3 and the other will have 2. Make sure you remember which is which. Okay, now, I do not want anything in my way that could get saliva. So at this point, you will always cap your alginate container back up, and we're gonna put it to the side along with the scooper because we do not need to have any saliva near that. You will put your spatula back on the tray paper, ready to go. Next up, we're gonna come over and we are gonna try our trays in. I'm gonna open both of them up. At this stage, you just take a peek at your patient's mouth and try to do the best guess that you can. Then we try it in. Please note, I want you to use the same grasp that you will take the impression to try it in for muscle memory. So 2 fingers here and then your thumb on the tab, okay? You're gonna come in, you're gonna pull your patient's cheek a little bit, have them open nice and wide. Come on this side, stretch the cheek on this side, and you're gonna place it as if you were taking the impression. You're then gonna slide your finger all the way back. And just make sure that you do not feel teeth behind the tray, okay? For the mandibular, you are gonna hold it like this. Same thing on this side. We're gonna come in, don't forget there's new material, you're gonna flip it on over, pull the cheek out on one side, slide it in. You're gonna ask your patient to lift their tongue, and then you would seat it down, okay? Same thing, I'm just putting my finger back here. I do not feel any teeth, so that looks like a pretty good fit, okay? Alrighty. I am gonna start with the maxillary, so I'm gonna put my 3 and 3 up here and leave my mandibular in the back. All right, we are gonna add the water to the powder. And you're just gonna incorporate. Make sure you get all of the powder particles incorporated first, and then we're gonna start that spinning rotation once I do not see any of that fluffy powder. All right, then we're gonna get that rotation. Get everything off your spatula, and we're gonna rotate. Make sure to clean your spatula every couple of rotations, just to make sure you don't have any lumpy areas on the spatula itself. All right, then I'm gonna gather. You also can put your tray back over here if it's easier, or you can leave it over there. And now I'm gonna get as much as I can on my spatula and back to front. Okay, straight up and down. We're gonna load it like this. Smooth it out. Don't forget you can set your tray down to get more on your spatula. All right, now I'm gonna clean up my tray. So you wanna make sure it's fully covered, but you do not want anything dripping out of the back because that's gonna go directly on your patient. I don't want anything on the outside. All righty, so then you're gonna get your fingers in place. You're gonna say, please open nice and wide. We're gonna seat it. You're gonna come all the way to the front. You're gonna push the back first and then come all the way up. And we're gonna hold. You can tell your patient breathe out of your nose, and you're gonna check in how you're doing, Stephanie. Good. And we're gonna hold. You can, if they start to feel like they're gonna gag, you can have them lean their head forward. Make sure that you're holding it the entire time. Do not put your other glove in their hair on their head, because as you can see, I have Alginate. So you wanna make sure that you're not getting anything on them. If you have some on your glove, this is what you can use as your checker to see if the material is set. If they're having a hard time, sometimes I ask them to lift one of their legs and rotate it around five circles, and then have them switch to their left leg, things like that, just to distract them so they do not gag. If they start to gag, then you try to keep the material in there as long as possible. Otherwise, it makes a huge mess trying to get it out of there. It should just be a little longer. Still doing okay? Perfect. Almost there. And we're looking for a nice rubbery feel. Almost there. We would like to wait 1 minute after it's set, just to make sure we don't have any distortion. That's the ideal. If your patient's doing a good job and can tolerate, you try to wait that extra minute. That's feeling pretty good. All right, so for this, you always want to make sure you put your opposite hand, your non-dominant hand, on the bottom to protect the bottom teeth. You're going to get your index finger in the very back corner, and you're going to pull down that rapid snap, and then we're going to take it out nice and quickly, okay? And then we have the maxillary impression. At this stage, now we're going to turn it around. We're going to look at it, make sure we have everything. Do we have the back molars? Do we have all the margins of the teeth? That looks good. So this back area here, it kind of flowed down back a little bit. Do not rip that off yet. We have a lab knife that we can do in the lab after the fact. We don't want to rip anything because we could potentially lose anatomy on the back. So we're going to grab our spray bottle. We're going to spray top down. We're going to spray the back. You're just going to spray everywhere to disinfect, okay? There was no debris in the impression, so I did not need to rinse it with water. And then I just give it a quick little shake, and you're going to set it down. At this stage, you do not touch the paper towels with your dirty gloves, okay? You would take off your dirty gloves, throw them away. You can sanitize, and then you are going to wrap it at this stage, okay? If you wrap it with dirty gloves, you have then infected this entire area, and all of that saliva would then go into the lab. So you have to make sure that you take off your gloves before you completely wrap this. So you just set it down and take your gloves off. All right, so we will move on to the mandibular. You also want to check in with your patient and make sure that they don't have alginate all over them. If you're going to take a lower impression, you can wait to clean them up until after, but check in with your patient. How are you doing? Good. Okay, good. One thing that can be helpful that you can actually do is give paper towels to your patient to hold in case they have anything at the end when you take the impression out. All right. So because I have a separate bowl, I'm just going to leave my bowl over here, but we do need to clean our spatula. You don't want any alginate on this spatula. Actually, I sometimes will put a couple paper towels on the side for myself for cleaning purposes. I'm actually going to wet one of these just to get a little bit more of that alginate off. At this stage, I do not have to cavi wipe the spatula because I am not re-scooping out of the bin. If we had to do a retake of the maxillary, you would have to cavi wipe this down so that you would not put saliva back in there. But because this is going right back in her mouth, you can just leave the spatula with saliva on it because it's her own, it's the same patient. So I'm gonna put my tray over here this time just to be a little bit closer. And we are gonna dump the water in and we are gonna go ahead and mix. Same thing, we're gonna incorporate until we do not see any of that loose powder. That's good. And then I like to start that rotation. So I push the spatula against my palm each time. That's what really smooths it out. And then again, I'm going to clean off the spatula and get that rotation down again. All right. And I'm going to get a nice spoonful here. And I like to come from the lingual. Again, there's no palate, so the mandibular I always find is a little bit messier to load, but I like to do it from each lingual half and just try to get it in there. And again, set that tray down as you're picking up your bowl. Don't try to hold it the whole time because you won't be able to get a good scoop of alginate in there. All right, and then as you can see, it's still pretty glossy, so I have plenty of working time. So take the extra second to clean this all up to make sure nothing's gonna drop on your patient. You wanna fill in these back corners though. We don't wanna see any of the tray. It should be fully loaded. And I think I mentioned in my PowerPoint, if you notice it's really rough on the top, you can get a little water and you can smooth it out. This looks pretty smooth, but if it's bumpy, just take a quick little second to smooth that off. All right, and now we're gonna do the lower impression for you. So we're gonna put our hands in position here. All right, and I'll put it nice and wide. We're gonna seat that there. All right, and then lift your tongue for me, please. And then we are gonna push down gently. All right, and we're gonna hold that. You doing okay there? Excellent. Having them lift their tongues just gives you space to place it, so you can make sure that you're seating it all of the way. You do want to keep your hands in their mouth to make sure that they don't move it when they swallow or that they move it around with their tongue. So always just gently, you don't want to put too much pressure, but you want to just gently hold it in there. You can also ask if anything is digging in there because sometimes you have to ease up on the pressure. Does everything feel okay? Great. Usually a thumbs up is what you will get because obviously they cannot speak. All right, and we're getting there just a little bit longer. I have a lot of saliva production, so that's why the paper towels are really heavy. Sometimes your patients will drool a little bit. Totally normal, but it's great to have the paper towels ahead of time. So even for the upper, I should have gave her the paper towels before. All right, that's feeling just about there. So we're gonna try to do that minute after, just to make sure it is fully set and we don't have any distortion. 10 more seconds. All right, so for this, we're gonna lift directly up on the tab, but make sure you always keep your fingers on the opposing arch. So we're gonna lift straight up. Sometimes I get my finger underneath the side here too. And we're gonna turn to the side and then take it out. All right, and if they need more paper towels, make sure that you get them more paper towels. All right, and then we can look at this here. So you can see we just want to make sure we have all the tooth margins. We want to make sure we have the back molars, that they're not off the tray and that it's centered. That looks good to me. So now we're gonna, again, go ahead and spray. We're gonna disinfect. Now that we know that we are keeping the impression, you are going to do the top, we are going to do the bottom, and we are going to set it down. Okay, take off your gloves. Sanitize. Wrap your impression. My impression's running away from me. Wrap your impression. All right, and then we're gonna check in our patient. Doing okay? Do you need more paper towels?
I'm all set, thank you.
All right, and that is Alginate impressions.